Welcome back to West Texas View.
As a mother, one of the things that just really bothers me is knowing that little babies are born infected with HIV. Little innocent children that just came into this world and have so many obstacles against them right off the bat. And so talk about this.
Okay, we are having very good luck today with many babies being born to HIV mothers and not having AIDS themselves. We're having very good luck with this because we have learned that
treat them in the womb.
Well, yes, somewhat. I mean, if the mother will get on the AIDS medications early on in her pregnancy and stay on them, it does not kill the HIV viruses, but it slows them down from multiplying so rapidly.
Yeah.
So they're still there, but they're slowed down. And then when she goes to have the baby, if they do not let the baby go through the birth canal, and if they deliver it C-section, and gently lift that baby out and clean it off, the baby can be fine. The babies develop their own immunity within the first year of life. And so many babies are born to a mother showing the HIV antibodies, but if the mother has done all the right things, it's weak. And they go on to develop their immunity and their immune system, and it sloughs it off. You have to get HIV into your bloodstream for anyone to get AIDS. And two of the best ways to do that is through sharing a drug needle. It gets into your bloodstream that way because when the virus is outside of the body, like in a tip of a needle, and when it stays warm, those viruses can stay alive up to 24 hours, and then you put it right into your bloodstream. You can, and of course, another good way of it getting into your bloodstream is sexually. It lives and harbors the most in the blood and in our sexual fluids. And so any thinning of your tissue up inside through sex, one of those viruses can go right in. We also tell the kids you can get it from tattoos and body piercings. And so we urge the kids to watch them rip open a new package and take out a new needle. Do not take their word for it. We brought Miss America here years ago, Kate Schindel, because she was the first Miss America to pick AIDS to talk about during her reigning year. And the reason she did was because her best friend, 18, went to get a small tattoo on her ankle. And, you know, they used that needle that they had used on somebody, and when it stays, when a speck of infected blood stays up inside of a tip of a needle, those viruses can stay alive up to 24 hours. And then, of course, through tattoos, it went right into her bloodstream. But babies, so you have to get it into your bloodstream. Babies, when they go through the birth canal, they're bigger than the birth canal. So when they squeeze through that tight space, that's the best time for there to be some tearing or thinning of the baby's skin, and the viruses can go right into the baby's bloodstream. Yes, when they do C-section, the mother's infected blood is there, but if the baby's eyes are closed and its skin is all intact, they can gently lift the baby out and clean it off, and the babies will be fine. And so many babies are actually being born to HIV mothers, and if they do all the right things, the babies can be, so we're even having better luck with that in Africa today. So we've learned a lot.
But the problem is a lot of young people are going to have the HIV virus and not even know it by the time they deliver a baby.
You bet.
And so a lot of those precautions aren't taken. Because if I understood you correctly, a test to determine if you have that virus is not given unless you ask for it?
It is supposed to, by law today, be given to a woman who's pregnant,
but not to other
right
ages.
Exactly. Yes, and I urge I urge all women who are pregnant, especially young girls, because we speak in the classroom and there are kids sitting out in the audience pregnant, you know, and so I urge the kids to not just assume when they went to a clinic and found out that they were pregnant, that they were tested for HIV. To not just assume that, because even though they're supposed to, they may not. So to call their doctor and ask specifically, did you test me for HIV? Because if they have it, we know they've had sex, they're pregnant. You know, that's a no-brainer. And
right.
if they've had sex with or without a condom, they could have HIV, but they wouldn't know it because they wouldn't have any symptoms. And so by being tested for everyone who's done anything, especially our young people, is the first step to treatment. They're not going to get treated if they don't know they have this. And so we urge all of them to go be tested.
Well, one of the things, though, we haven't really talked about is how you really started to give support and aid to the patient and the family, because there wasn't really a lot of support for the families and the patients in those days. And so you're still doing that. And so you're still working with about 300 families that you help the families know how to deal with this, and you help the patient navigate through the obstacles that are in his or her path. And so how does a person access this help? Or how do they access you if they want you to come into their school or their church? And that's something we ought to also say, is that your church was very supportive of you in those early days and helping you. So how does people access you?
All they have to do is call. I mean, we will go anywhere. We are invited. We want this message to reach as many people, parents, all adults.
And it's listed in the phone directory as
MAAS, but I believe it's listed as Midland Odessa Area AIDS Support.
Okay.
But I also give out my cell phone number. Anybody can call me.
And you've seen the contact information rolling across the screen that gives you both a computer access as well as a phone access. And so be sure and call this. We're going to have to take a break in just a minute and continue this conversation, but I certainly wanted to get that information out before we forgot it, because there's some other things that you need, and the last segment of the conversation we're going to be talking about that, but you need some volunteers, you need some people that feel as passionately as you do to go into the schools and the churches and the other organizations, and then you also need financial support. And one of the things that we need to really say, emphasize, is that you go into private clubs and organizations. We'll be back in just a minute and finish this conversation.
Stay tuned. West Texas View will be right back.